Thank you all for joining us this morning. I'm District 2 Supervisor Catherine Stephanie, and I'm pleased to be joined by Dr. Grant Colfax, Director of the Department of Public Health, to announce the city's first low acuity continuing care site. Early on, the leadership of the Department of Public Health flattened the curve in San Francisco. It has not been easy, but the steps we have taken together have saved lives. One of the primary reasons the city acted so quickly, so early, was to make sure that we did not overburden our healthcare system, to make sure that healthcare professionals in San Francisco did not have to make the heart-wrenching decisions about who deserved care and who did not. As the state of California and Bay Area counties have begun to gradually reopen, however, we are seeing some troubling signs. As of this week, we have seen 6,197 positive cases, with 57 deaths in San Francisco. We have a 7-day average of 98 new cases per day. Our demand for acute care and ICU beds for COVID-positive patients has grown at a rate of 15% each week during the month of July. This is of great concern. So, as we see more and more cases, and increasing levels of hospitalization, we must act upon that concern. That's why today, Dr. Colfax and I are announcing the establishment of San Francisco's first low acuity medical site, located at 1163 and 1167 Gorgas Avenue in the Presidio. The site will be staffed by medical professionals and will open with 20 patients. At this time, the facility is not expected to treat COVID-positive individuals. When I toured this facility with Dr. Colfax and the staff from the Department of Public Health, I was truly impressed by its transformation into what will be a first-rate medical facility. At capacity, the site will allow the city to provide medical care for up to 93 San Franciscans who receive treatment here in lieu of a hospital visit or who have been discharged from a hospital but still need short-term supervised medical care. The city's ability to confront COVID-19 depends on our ability to care for those with all manner of medical conditions. San Franciscans continue to experience everything from sprained ankles to broken legs to infections to heart attacks during this difficult time. Unfortunately, other ailments are not stopping just because of the pandemic. Opening this facility will allow the city to shore up our medical resources and bolster our hospital capacity. In doing so, we are proactively preparing for future COVID-19 surges. And I want to reiterate, this new low acuity medical center is an inpatient facility. The patients staying here will receive treatment at this location in lieu of hospital care, or they will have been transferred from a hospital. It is not a drop-in acute care site, testing location, or shelter, so please do not visit this location if you are seeking any of those services. Finally, as the District 2 Supervisor, I would be remiss not to highlight the city's long history with the Presidio in responding to local emergencies. From the 1906 earthquake to the 1918 influenza pandemic to Loma Prieta and now COVID-19. The Presidio is an incredible resource, and I am grateful for our continued partnership with the Presidio Trust. Even months into our response, this pandemic is unprecedented in modern history, but I have been so inspired by our community's compassion, bravery, and resolve during this time. We will only get through this if we continue to take care of one another and look out for one another. So thank you again, and with that, I'm happy to introduce Dr. Grant Colfax.
Good morning. I am Dr. Grant Colfax, Director of Health. Thank you, Supervisor Stephanie, for your leadership and support during this unprecedented time. Today, like every day, I checked the number of patients hospitalized with COVID-19 across San Francisco. Unfortunately, that number is higher than it's ever been before and continues to climb. In April, we experienced a surge of COVID-19 cases. which at its peak saw 94 San Franciscans in the hospital. That number dropped to just 26 patients 6 weeks ago. Today, it's 107. And of those, 1/4 are very sick and in intensive care. Across the city, we now have more than 6,000 cases of diagnosed COVID-19. And look, it took us 38 days to go from 2,000 to 3,000 cases. It took just half as long to go from 3,000 to 4,000. And in just 10 days this month, we went from 5,000 to 6,000 cases of COVID-19. Let me be clear. We are in a major surge of COVID-19. The virus is moving fast and more people are getting seriously ill. If things continue at current rates, we estimate that on average, we will have more than 750 San Franciscans in the hospital by mid-October, and more than 600 deaths from COVID-19 in 2020. Plausible worst case scenarios put us at 2,400 hospitalizations and 1,800 deaths. These scenarios, unfortunately, become more likely as each day goes by with the current trends. Now today, fortunately, all COVID-19 patients are getting world-class treatment from some of the most caring, dedicated, and superb medical professionals. And we wish these patients the very best as they fight this serious illness. And fortunately, for now, we still have capacity in our hospital system to care for patients. It is good news that our healthcare system has not yet been overwhelmed, as we saw in New York and we are seeing in other regions across the country as I speak. Many San Franciscans are contributing to that by staying home, avoiding gatherings, covering your faces when you go out, staying at least 6 feet apart from others, and washing your hands. You are preventing more illness, more spread, and helping to keep our healthcare functioning. But the city must continue to prepare as this surge continues. The number of people in the hospital today tells us how many people became infected with COVID-19 about 2 weeks ago. Right now, we are seeing close to 100 new cases of COVID-19 every day in San Francisco. That puts us in the red zone, continues to put us in the red zone of one of our key health indicators, and we have been there for over a month. It is extremely sobering that we have reached this point. It is extremely concerning. Our reopening remains on pause. San Francisco remains on the state watch list. The main reason we joined that watch list was because of our rapidly rising hospitalization rate. We have 15% more COVID-19 patients in the hospital than we did just a week ago. Our goal is to keep the increase of hospitalizations to less than 10%. Since January, the health department has been planning and preparing for COVID-19. The city's COVID command center is buzzing with activity every day. As we have planned for surging COVID-19 cases, we have built up the capacity of our healthcare system. For example, we have added testing sites outside of our brick and mortar clinics and deployed mobile sites to neighborhoods most affected by COVID-19. We have created an entire testing infrastructure that now serves thousands of people a day. For a time, we restricted elective surgeries and routine procedures to make room for an anticipated increase in COVID-19 patients. And today, as Supervisor Stephanie announced, we are creating a care site in the Presidio that we hope we will not need. It's located in the Presidio, but would serve all San Franciscans in the case of need. This site is designated for hospitalized patients without COVID-19 who no longer need acute medical care, but aren't quite ready to go home. Instead, they would be discharged to this new care site. There, they would have medical supervision from skilled professional staff and access to physical therapy and laboratory services. We could take as many as 93 patients at this site if needed. But again, I hope this day won't come. We hope our hospitals will never need to open the relief valve that this site represents. But that depends on you. That depends on all of us. We all, and I mean all, must do our part. Please wear a mask. It's really not that hard. I want to see San Francisco opening schools instead of medical sites, and I know you do too. We all want to see houses of worship open their doors, to sit in our favorite barber's chair. So many people in San Francisco want to hug their grandchildren and play soccer with their friends again. And we should all be able to do that. We can make that happen. We still have time to turn this around. If we want those things, we can't take chances and hope that this virus is not as infectious as the data, science, and facts tell us it is. We need to commit and recommit on a daily basis to being careful. Indeed, and this is important, everyone needs to behave as though each of us could have COVID-19. Each of us could have COVID-19. Think about that. We know that as many as half of people with COVID-19 don't have symptoms during some period of their infection. It doesn't matter how you feel or look, or even if you got a negative test. Be careful. Every time you wear a mask, socially distance, wash your hands, and avoid gatherings, you are moving us closer to the day we can live more like we did before sheltering in place in March. And every time you make a different decision to take a risk, you move us in the opposite direction and farther away from that day. The precautions that we take to slow the spread of COVID-19 really work. We've proven that in San Francisco. We can prove it again. Covering our faces may be the most important. On Friday, San Francisco updated the health orders on this so that everyone aged 10 and up must wear a facial covering. Again, everyone in San Francisco over the age of 10 should be wearing a face covering when within 6 feet of people outside your household. If you're alone in a space that other people might use later, like an elevator or conference room, cover your face. If you're using equipment that other people might use later or handling food for other people, cover your face. Basically, cover your face. If you're passing someone on the sidewalk, your face must be covered. Other things that we must do: washing our hands, staying 6 feet apart, avoiding gatherings, as hard as that is to do after all this time. If you are meeting for essential meetings, meet outside if you can. And of course, please, you must stay home if you are sick. Short of a vaccine or a cure for COVID-19, these are the most effective interventions that we have available to us. And they work if we take them up and practice these behaviors every day. Indeed, you are the intervention. You can do this. It's up to us to flatten the curve again. Thank you.
Thank you, Dr. Colfax, and thank you, Supervisor Stephanie, for your time. We'll now begin the Q&A portion of this meeting. For now, we have a variety of healthcare-related questions for Dr. Colfax. Dr. Colfax? The first question is from Janie Har with the Associated Press. We haven't seen the devastation of COVID-19 illness in the homeless communities as we feared, at least not yet. Why do you think that is, and what can we learn from that, either about the coronavirus or people experiencing homelessness, or both?
Well, I think it's a number of factors that so far have helped us avoid worst case scenarios with regard to people experiencing homelessness in the COVID-19 pandemic. We took action early on with our partners at the Department of Homelessness and Supportive Housing that run the shelters, and with our Human Service Agency partners, ensuring that within shelters that best practices were rapidly applied so that people had the education and the materials necessary to reduce the spread of COVID-19. Other key interventions that we did, and I think this is very important, is make available hundreds of hotel rooms so that homeless people people experiencing homelessness who are most vulnerable to COVID-19 were able to access hotel rooms to shelter in place. And over 3,500 people have been placed in those hotel rooms. And then we've done a lot of outreach work on the street as a city, again, providing hygiene, mask, and education for people who are on the street and experiencing homelessness. We had a intense clinical team that provided healthcare to people experiencing homelessness before the pandemic. This team has been working around the clock, again, with our other department partners to ensure that people get the best care. And if they go into the hospital, that they are also discharged to isolation and quarantine rooms so that they are not ending up back on the street with infection. So it's a variety of actions that we've taken to avoid, I think, some of the outcomes that we've seen in other jurisdictions.
Thank you, Doctor. The next set of questions are from Stephanie Sierra with ABC7. Dr. Fauci and Dr. Birx have both said publicly in the last week that face shields should be worn in addition to face masks. Do you foresee this being a new requirement for essential workers?
So I think the role of face shields, it really, it depends on the specific circumstances. I think when we're talking about the facial coverings right now, the most important thing is that we ensure that in public that everyone is wearing a face covering if they're over 10 years of age. And we have also been very clear that protecting our healthcare workers is key, and are looking at the role of face shields in addition to the mask that we're already ensuring that everybody has.
Thank you. Also from Stephanie Sierra, how close is San Francisco to getting off the watch list?
We continue to see increases above the 15% hospitalization rate. We're watching that number carefully, but I can't speculate on how soon and if we will get off the watch list. I will just emphasize again, we are in a major surge here, and we are anticipating on average that we would have over 750 people in the hospital by October. So if we're on the watch list, off the watch list, get back on the watch list, I think what's really key is that we work to flatten the curve, and we recommit ourselves to doing this. We've done it before, and we can do it again, but it's going to take the whole community to reinforce these efforts that we know work.
Thank you. From Gerald Chin with SFA. Are social gatherings with people outside of their households continuing to be the main cause of the new surge in cases?
We think that gatherings are certainly contributing to this, which is why it is so important that people do not gather outside of their household, if at all possible. And certainly people should not be using testing as a tool to decide whether they can gather or not with others. A negative test doesn't mean that right after you get the result, you could become infected. If you go to one of these gatherings, if someone is infected, the virus is, as we know, extremely contagious. So certainly gatherings are contributing to this increase. And of course, the more virus that is around, the more likely, if you go to a gathering, that somebody has the virus and is going to transmit it. It's hard for us to accept. I think it's human nature to hope for the best. which I certainly appreciate, but we have to understand that with more virus in the community now than ever before, you saw how quickly we went from 5,000 to 6,000 cases. The odds of somebody being infected at one of these gatherings has increased dramatically over the last few weeks. Please don't gather.
Thank you, Doctor. We have a handful of questions from multiple reporters about San Francisco issuing fines. Similar counties like Contra Costa are issuing and imposing fines on people who don't wear masks in public. What are your thoughts on that? Is San Francisco going to do that? Why or why not?
So certainly we have been emphasizing the need for these interventions, and our health orders, again, require masking, the social distancing as we continue to emphasize. And we hope that people will adhere to these requirements. And we're exploring how we may increase enforcement, particularly among in situations where requirements that are very clear and that we've emphasized repeatedly are not being followed, and this would be enforced most likely in terms of following up with businesses and other situations where people gather. We are focusing on working with community and community stakeholders to increase voluntary compliance, but certainly we're looking at increasing enforcement as necessary, especially in this surge situation.
Thank you. From Joshua Sabatini with the San Francisco Examiner. Related to the Presidio site, who is paying for it and who will staff it? What has it been used for, and is it ready to accept patients now?
I'm sorry, could you repeat the question?
Sure, I'll start with the first two. For the Presidio site, who is paying for it and who will staff it?
So we are, the city is funding the Presidio site, and it will be staffed by a combination of health department and UCSF providers. And it, again, will take care of a total of 93 people who are low acuity patients.
And if I understand Sabatini's next set of questions correctly, what has the site historically been used for? And is it, if you didn't mention it already, able to accept patients immediately?
So it will be, it's prepared to accept patients. We're not planning to open it immediately. It will be based again on the capacity of our hospital systems across the city. So that will again depend on if this surge continues and there's a need to move people out of the hospital quickly in order to make room for COVID-19 patients. That's when we would open the site. I can't speculate on the past use of the site, but we can certainly provide that information.
Thank you, Doctor, and thank you for your time today. With that concludes today's press conference. If members of the press have any questions afterwards, please email dempress@sfgov.org. Thank you. Take care.